I want to answer some of the questions and deal with some of the issues that are floating around about the so-called healthcare reform plan. For some of us who are looking at this, it's anything but a reform. So I'm going to address some of the specific issues, and I hope it's helpful to you. One of the rationales for pushing healthcare reform is that we have 47 million uninsured people in America. That number is not at all a real picture of what's happening. Of that 47 million, an estimated 12 to 13 million are illegals. Now, I'm not sure that it's the responsibility of the American taxpayer to provide comprehensive health care insurance for people who snuck into this country and are here illegally. There's another significant portion of those people out of that 47 million, an estimated 15 million, who qualify for some type of existing plan. They just haven't bothered to sign up for it. Now, if they haven't signed up for the plan that's already available to them, what makes us think they're going to sign up for a plan that we create? And then there's another significant number, probably about 10 million people, who could afford insurance. They make more than $70,000, but they just choose not to buy insurance like many of you do because they assume they're not going to get sick, and if they do, they'll worry about it then. Instead, they bought new microwaves and television sets and pickup trucks and boats. That's fine. But now we're being asked as taxpayers to pay not only our own insurance, but to pay more so that we can cover the people who could be paying but have chosen not to because they want to use their money to buy other things. The reality is the total number of people in this country who are uninsured and who can't really do anything about it because they just don't have enough money or because they're maybe saddled with a pre-existing condition, that number is far less than 10% of that 47 million, somewhere between 2 and 5 million people. Why don't we deal with those and fix the situation for them rather than change the rules for every one of us as Americans, not even knowing if it's going to work? My suggestion? Try some of these ideas out in a few select states. That's what's supposed to happen in our form of government. And if it works in some states and it really is great, then we can try it on the rest of the country. But if it doesn't, we will not have completely undermined and overhauled the entire federal healthcare system, only to find out that it didn't work, but then it's too late. Now we have something that the rest of all of the nation is going to have to live with from now on. That's why we've got to make some real challenges to this Obama and Democratic congressional healthcare proposal.